snot, rashes, and vomit bugs begin. So is childcare a germ factory, or will the constant illness eventually create a healthier child? We now speak to pediatrician Dr. Benjamin Lundaleni, who will basically be talking to us about how to care for your little ones. A very good morning, Dr. Benjamin. Thank you so much for joining us.
Good evening, and thanks for having me.
All right. Now, doctor, it's common for smaller children to get sick once they start going to daycare or kindergarten. Why is this?
There are various reasons why they get sick. I think we can perhaps begin with the obvious, that they don't have a well-established immune system.
Okay.
Second is that they sneeze a lot, they cough a lot, and they don't close or cover their mouth. Third is that the upper respiratory tract infection in children is poorly developed, and it transmits a lot. It helps with the transmission of various infections. And perhaps the last one to consider is that you have a problem with environment itself. It's a closed environment. So it helps with the spread of infection, and specifically viruses.
All right. And would you say these are some of the most dangerous infections and viruses out there?
It's perhaps not so dangerous. I mean, they get sick now and then, but many of them will not require treatment. I mean, hospitalization, perhaps just a visit to a doctor, and then treatment is offered.
All right. Now, what are some of the most common illnesses they can pick up?
The commonest one is usually the respiratory tract infection, which may range from what is regarded as common cold, flu, and remember the two are completely different. Is the two sides of the coin. One, colds are usually milder than flu. Flu is usually caused by influenza, parainfluenza. And then obviously the stomach bug. They tend to develop diarrhea quite often.
Okay.
Partly because they don't wash their hands. They will go to the toilet, they touch surfaces, which is also the reason why they get sick, without cleaning their hands. And then obviously the other one is that they have a habit of putting their hands into their mouth. And obviously bugs find their way into their tummy.
Okay, so mostly the cold, flu, and the stomach bug.
Yes, those are the two common ones.
All right. Now, we also have those that get rashes as well as fevers. Talk to us about, some of these. How common are they too?
Skin rashes are very common, specifically in children. And we often, most of them are harmless. However, when you have skin rash in association with fever, it does beg the question as to whether this is serious or not serious. And perhaps one has to always be on the side of caution, specifically when they have fever. The majority will still be viruses. We have things like chickenpox, Roseella, and then there's something referred to as a fifth disease. And all of them will manifest with skin rashes and fever.
A fifth disease?
Fifth disease,
okay.
Yeah. And then obviously you have bacteria. Scarlet fever is one of them. It's caused by a strep bacteria. But then you can also have skin rashes, which are meningococcemia. They are like little dots. We usually refer to them as petechia, which are non-blanching.
Okay.
But those ones are usually a sign of serious problems. And then obviously you may have drug reactions. And drug reactions tend to cause fever. And usually this is something that happens immediately or soon after they have taken the medication, or a newer medication for that matter.
Right.
So you see them now perhaps developing rashes all over their body, and they may also have accompanying fever.
All right. Now, doctor, you mentioned a few viruses and so many diseases, so many viruses and a few diseases. Just how treatable are these? Are there also maybe home remedies that we can help the kids with, or would you just recommend straight to the hospital?
No, the majority of them can be treated just by supportive measures. One of the problems is always that they may be itching, so you can look at how to lessen the itchiness. And then obviously temperature, because you have to give them antipyrexia if they have temperature that are rising. And of course, if they are getting worse, meaning that the symptoms perhaps, these are children that are restless, perhaps not eating anymore. They may have developed respiratory symptoms or difficulty breathing, or the ones that they have increasing in terms of the number of skin rashes all over the body, and perhaps swollen parts of the body, such as the eyes, the lips, etc. So those may be referred to a doctor and perhaps hospital, but a number of them can be handled just by giving them home remedies. But obviously, if they have severe fever, that may be. And again, the size of the child. So smaller ones, it will be safer to take them to a hospital or to a doctor. And the bigger ones, you perhaps can look at how sick they are. If they are not very sick, they can be managed in the home.
All right. Now, would you say some of these viruses and diseases well establish the immune system?
Sorry?
Would you say that some of these viruses and diseases well establish the immune system?
Of course, yes, they do.
Okay.
Remember, they are developing now an innate immune system, so you are priming them for what is going to happen later in life. Okay. So as much as you would perhaps feel guilty sending them earlier, years later you may not be dealing with the same problem because the immune system would have its ability to fight.
Okay.
So you don't have to keep taking them to hospital or taking them out of school.
So the immune system will get used to some of these viruses?
It's actually developed.
Okay.
So remember, it's based on recognition. So if you have come across something, then you build memory, which is now what we call an immune response, which you would be responsible for an immune response later in life.
So we should just let them fall and not pick them up. So no. Basically, that is what you're saying.
No. Basically, an exposure is not a bad idea. That's what I'm suggesting. That while you may feel you are doing them harm, they are gaining in the process. Okay. So the first year of life, they may have many infections. And the second and the third year, you may not see that again happening.
All right. Now, doctor, what are some of your go-to vitamins and supplements that you can perhaps just tell our viewers this evening that they can give to their children for immune boosts? Okay,
before I answer the question, I want to just perhaps make a statement that there is huge confusion out there that vitamins or multivitamins are given to boost appetite. They are not appetite.
Okay. They're not appetite boosters.
No, they are not.
Okay.
They are not. So they are basically designed to give individuals what they may not be getting in adequate amount from the diet. So the diet may be deficient of certain items, certain vitamins, certain minerals, and that's what you are giving them. Unfortunately, we think that when they are on it, they are eating better. There are appetite stimulants, but they are not appetite stimulants. So vitamins are not that.
Okay.
So the number of them have got basically the different vitamins. The one that is that comes to mind is always A, which helps with the eyes and the skin and so on. So A, C, B, D, K, which is usually the lipids one, and then obviously the B complex, and then some minerals. They will have zinc, they have got other things, and many of these things function as an immune booster. The choice of of multivitamins should be carefully done because they are not all the same. Okay. Neither do they do the same thing.
All right.
So, for the smaller baby or the newborns, we tend to give Vidailen, and we add iron to it because they often have a problem with iron. Alternatively, we can use what is called Kidivite, and it also comes with iron or without iron. Now, the problem with iron, makes it bitter taste. So there's that bitterness when they take it, and many of them may not like it. Also, that the stool color may change because of the iron. So people have to just be careful that you don't throw it away because of that. In general, the bigger kids, you can offer them other things, which comes in the form of a syrup or a chewing, like there's like something called crash guard. There's the other one, gummy bites. The kids like it because they look like sweets and they taste quite okay. Similarly, you can come across something called Diovite. Diovite is the one that recently entered the market. It has got immune boosting. It helps with memories and so on. So there are few advantages to using them. So, but many of them focus on immune boosting. So if that's your focus, then you can think of things like Zimplex.
Right.
And that's also something that you can offer to children. It comes as a syrup, and I think there is also capsules that kids can take, the bigger ones,
Right.
not the little ones.
Dr. Benjamin, thank you so much for joining us this evening, and we wish you all the best with the rest of the day.
Thank you.
All right. That was Dr. Benjamin Lundaleni, who is a pediatrician, talking to us about childcare today and also just recommending a few vitamins as well as supplements that parents can give to their children. Don't go anywhere. We'll be back with more.